who to ask the most
Interacts.
question, interacts, invites people. So that area of Xeomin for here, and then same thing with the eye cream. So ask questions, interact,
Yeah.
invite your friends to join, and obviously you have to be following us. So if you're just tuned on and you're not following us, follow us.
That's right.
All right.
All right, let's get started.
So let's get going. So first, a little bit about Renew. What makes Renew different from every other aesthetic place out on the blocks out there?
I think we really personalize our treatment for patients, and we really take our time. You know, I know some patients have come in, they're like, oh yeah, I got treated somewhere, and it was literally like a factory. It was like, boom, in the chair, out. And then before I could even fully get out the door, the next patient was in. And, you know, we really pride ourselves on being almost like concierge and taking our time, making sure we listen to our patients, and, you know, working with you to come up with, you know, the best treatment plan for you.
And I think I had a patient who said it the best way yesterday. She had been injected somewhere else, had, you know, big cheek kind of sticking out here.
Mm-hmm.
And so I injected her and did her jawline, because I see a lot of people get mid-face and no jawline. And she looked in the mirror and she's like, that's the difference between doing it right.
Yeah.
And to do it right, you have to take your time, like you said.
Absolutely.
You can't just keep people in and out, in and out. Has to take your time. You have to look at the whole face, the whole package.
Absolutely.
And give that whole transformation plan. So that's what we do, and that's why, you know, there's different practices. There's an In-N-Out Burgers practice, and then there's Renew. So
absolutely.
And you'll be much happier, because we're not going to just fix what you say you see. We're going to really fix the whole problem with what's happening.
Yeah.
So we're going to talk a little bit about Belotero. So Belotero, many of you know of it, some of you don't. It's a hyaluronic acid filler. It's actually, if you look at the whole spectrum of hyaluronic acid fillers, it's the thinnest filler out there. So we've got the very thick, heavy-duty lifting ones, and then we've got the really thin one that
very
integrates.
Spreadable and integrates, yeah.
Yeah, so I was so happy when Belotero came out, because I have been practicing 20 years, and you hear me say the story all the time. We had the collagen fillers that only lasted 2 months and were very thin, and we could put them in the little lines here without overfilling. And then when Restylane came up, and you know, there wasn't that filler until Belotero came along.
Yeah.
So now it filled that little niche. So it's a wonderful filler. Difference is it's thin, integrates.
It's very soft and very, I feel like it can be buildable too, you know, like you can use it in places that are very tricky, like you said, you know, right above the lip lines, but you know, it's also, you can put it in the lips, and you can put it, you know, in the tear troughs, and you kind of can, you know, layer it up and build it up a little bit if you need a little, you know, a little bit more like holding power, but it's just, it integrates really beautifully into the tissue.
I think that's the biggest difference. So we're just going to talk about the places that we can put it,
Yeah.
which is, there's a lot. And the key to Belotero, I remember when it first came out, I was sitting at an event with a whole table full of plastic surgeons, derms, and myself. And Belotero came up, and everybody's like, I don't like it. I don't like Belotero. And I'm like, oh my God, it's like my favorite. I'm so happy it came out. But I think the problem with Belotero is if you have to put it in the right place. It has to go in the right plane in the tissue. And that's, again, the difference between going somewhere and coming here. You know, we know those differences in the types of fillers.
Right.
And, you know, Belotero, if you can put it in a lip, it will be nice. It's not going to give you the most volume. It's great for who those, number one, older patients are very hesitant, right? Yeah, when they come in and they say
50 times, I don't want big lips, I don't want big this, I don't want a lot of volume.
And then when they come back the next time, they be, okay, I'm ready for the next step. But it's a good first step. It's great in outlining the lips. So we'll talk about Bello and the lips first. It does a great job for outlining. And the other thing is that it, like, I feel like nothing can beat Belotero for those.
Those
Little-
oral Rytids, the smoker lines that
This-
most people know them by.
You know, and I feel like that, especially the people that come in and they're like, I can't stand those lines above my lip, and I'm sitting there in the chair thinking, I don't really see any lines above their lip.
Yeah.
And then I get up with the light, and they're very, very fine newbie lines. That's where Belotero, like,
Works amazing.
nothing's gonna work as well as Bello there. So,
Yeah.
fine lines for newbies' lips who just want a little bit, or want their lips outlined nicely.
Outlined.
The other thing it does a great job is turning up the corners of the mouth.
Mhm.
If somebody has an etched line, like in their nasolabial fold, or etched lines out here, it does
Yeah.
a great job. Etched lines.
I feel
awesome.
like it's a great product to kind of like airbrush, you know, pretty much anywhere. So if you have like some small little textural lines or, you know, little fine lines, this just works really good to kind of just airbrush them and smooth them out.
Yeah, because you can put it very high up again
Right.
in the tissue. You put it down too low, it just goes away fast. But if you put it up superficially in the tissue, it's beautiful.
Yeah.
So lip area, all kinds of ways to use Belotero all day long. The next place is tear troughs under the eyes.
Mhm.
That's really my favorite product for there, and the reason being, I think a lot of products that are put there are just too thick, too heavy. You get into trouble with being overfilled because they bring in more water.
Mhm.
You can have that Tyndall effect, which is
Bluing
not
and kind of
nice.
bluish tinge, and you start to almost look like you have a black eye.
yeah. So those are with other fillers things that I found
Yeah.
I didn't like. The Belotero, the interesting thing is there it goes deep. It's put deep on
Right.
bone, and it lasts 9 to 12 months.
Yeah.
Because if it sits on the bone, it's really nice. So we can volumize, but then because it's very flexible and nice up high, you can actually put it high up in the
Little bit.
tissue and not get the Tyndall effect. So I find it to be the best for
Tear
under the
troughs,
eyes.
yeah.
I love it.
That's
for
such
tear
a
troughs.
tricky area too, like, and I always, you know, for me, if you've had a consult with me for that specific area, I always tell patients it's better to undertreat that area than overtreat that area, because how many times do we get patients in the office with, you know, just way overfilled tear troughs and, you know, bulgy looking, you know, I mean, they have like a ledge, you know, because there's just certain products that don't belong in that area. This is very fine, thin tissue,
Yeah.
so you need something that's very fine and thin as well.
And I think that with Bello, I have never seen a patient overtreated with Bello
Yeah.
under the eyes. I feel like you could put a lot of product there, and it's never gonna look like that because it's not hydrophilic, it doesn't bring
Right.
the water in, and it integrates, it spreads into the tissue, so it just spreads out nicely. So
Yeah.
under eyes, I think hands down, it's Belotero. What about, you know, I think for under eyes, one thing to talk about is technique. So,
Mhm.
I think for the longest time, I didn't want to do under the eyes. I never had a technique that I
Love
felt that was safe, that I liked. I mean, there's ones that, I mean, going from here, I mean, we're talking way back in the day.
Yeah.
Some very, what I felt was unsafe ones or didn't give you the right results. So, I kind of ended up coming up with my own technique, which I use a cannula for mine. I kind of do 3 different ways for mine, and then I'll let you talk about how you do yours. I do cannula coming from the side, and it's really painless and less bruising. So a lot of times we can just volumize that way. Sometimes have to go a little bit under to get into the central tear trough, if somebody has that. And then always going out, if we have something going on out here, it's more of needle down on bone to give more volume, and it just always works out nicely.
Yeah.
So different people have different ways that their tear trough
Right.
is aged, but I think those ways are, you know, it's kind of a combination of those 3 different ways
Yeah.
that I like.
I
What
would
do
say
you
I'm
usually
probably
do?
I'm very similar. You know, it's really, you know, patient per patient dependent. Like she said, everybody ages there has different problems in the tear trough. But I would say I usually do a combination of cannula as well. You know, my entry points vary again depending on the patient. Sometimes I have to come from like the, you know, medial cheek, or sometimes from the lateral portion and kind of come this way like Dr. Barrett said. Or the other thing I like to do is I actually like to use the BD syringes, and I'll backfill them and use that to kind of just do my little aliquots right down on bone, and just kind of, if they have a lot of hollowing, to kind of just help pop that up a little bit.
Yeah, I find especially on the
lateral rim.
Yeah, right there is really beautiful.
Yeah.
So I think using all these techniques, we can always get you to have a nice looking under eye, unless you have too much laxity, or you know, your fat pad is just really down. I mean, there's some patients I just say, you know what, I think surgery is the best bet for you, because it's, in those cases, it's just, we can camouflage a little bit, but not completely.
Yeah. And I think one thing, and maybe you agree or disagree with me, but I always say with your tear troughs, you're never gonna have 100% correction in that area. You know, we usually shoot for about like, say like 50, maybe 60%, you know, and that's kind of on the high side. So, you know, I always try to lay those expectations down for my patients too, because, you know, if you've always had dark circles and hollowing and you come in for tear troughs, don't expect that to be completely gone. You know, we can improve it significantly, but, you know, I think that's important too, because like we've mentioned, this is such a sensitive area, thin tissue, you know, you definitely don't want to overtreat.
Yeah, definitely. But I think 60-70%, you can usually get a pretty nice result. But you know, it just, and sometimes you have to build on it, but usually once you get it there, it's gonna last you, you know, 9 to 12 months. And then if we put the laser with it, where we're tightening the tissue, because a lot of times that's the issue, there's laxity. So a lot of times we'll recommend that with the Renucool laser first. But so, well, we've got some pictures of eyes. So we've got some hollowing here, and you can see actually really beautiful correction there. This was somebody who, one of my younger patients, and this was a long time ago when I was not really liking to do under eyes too much, and she looked like she didn't need them because she was so young and beautiful. But when we did them, it was like, okay, yeah, I guess you're right.
Nice refresh.
Yeah, really nice. This is an older gentleman, and he's had a combination. He had the laser under, as well as filling with the Belotero, so nice. And then the other thing about under the eyes is we're always gonna lift the lateral cheek up, the mid face up first, because that will help a lot of times.
Yeah.
And it makes it feeling
100%
easier.
agree. Sometimes just by correcting the medial cheek or in the lateral cheek, you actually don't even have to do anything to the the tear trough.
Sometimes it's just enough. So this is another patient, and you can see, you know, she's got some hollowing there and improvement, and you can see improvement. I don't know if you can probably see it from where you're at, but improvement in the skin tissue there. And these are the barcodes we were talking about. So this is just, it's beautiful. This patient did not want any lip volume, which she probably needed a little bit, but she just had those little tiny lines there that drive everybody nuts, and you can just go in and boop, get each one of them. So we didn't talk about this, but this is an area that I think people forget about. I love doing the necklace lines.
Yeah.
Because it's just, you just go in there and immediately get some, you know, fine line improvement. Obviously laser is gonna give you the best for long term, but this is for impatient people, and we'll get in there and just smooth that right out.
Yeah.
Everybody's hearing us okay? Just wanna do a sound check. Can you hear us? Nobody's complaining, so that's a good thing.
I feel like these necklines too, especially in today's day and age, it's such a big problem because everybody's constantly on their phones or on their computer, so we're constantly in this, you know, position, and that's what's creating these lines. And unfortunately, people don't like to really invest their money and their time into their neck. They want to focus mostly on their face, but you know, it gets to a point where we have to kind of remind them, you can't neglect this area too, because this, you know, if your face looks 40 but your neck looks 80, like it doesn't look good either. So you kind of want to make sure that you're keeping everything matched and looking, you know, in the same decade.
Problem. It's like, you know, face looks awesome. Oh my God, let's not forget your neck, or the décolleté. If you come in with a low shirt, I'm like, we can't do that. Yes, we have a question.
Yes, how many units of Belotero do you recommend for upper lip?
So for upper lip, so Belotero, we usually go by syringes, and most of the time we can get what needs to be done with one syringe. Actually, that goes a very long way. You know, we can usually do all the upper lip lines, do the corners, pop the corners up,
Yeah.
and even hit some other etched lines around that area. So I would say perioral area in general, I
Yeah.
would say one syringe is perfect.
Perfect.
Good question though. All right, so there's another Belotero and no Belotero. So,
Yeah.
all right, so Belotero, any questions? If, let us know, but we're gonna move on to Xeomin.
Yay.
So Xeomin is a Botox alternative. So there's
Yes.
really 4 brands of Botox or neuromodulators out there.
Mm-hmm.
We've got Botox, Dysport, Jeuveau, and Xeomin. And we actually don't carry Jeuveau. We do Botox, Xeomin, and Dysport. So, what I always tell people is, well, do your spiel, because I get tired of my spiel.
No, I mean, basically, I think we kind of say the same thing. You know, try them all out and see if one, you know, works better for you than another. And then, you know, once you find that one that you feel like the longevity is best, you like the way it feels on you best, then, you know, then you can kind of stick
Or
with
whatever's
that.
on sale. So a lot of my patients, since most of them work all the same, they pick whatever's on sale that month. So, yeah. So I think the best thing, since we have a little more time today with, you know, just talking about 2 products, is all the different areas to put Xeomin that people don't always know about.
Yeah.
Sweating, it's getting hot out.
Mm-hmm.
What if somebody sweats a lot under their arms? Or I had somebody who came in and that person sweat profusely on his forehead.
Yeah.
It's amazing what that does.
Yeah.
So you can put that in, and the fascinating thing to me is that normally Xeomin is gonna last like 3 to 6 months depending on the person, but when you're doing it for sweating, under the
Awesome.
arms for sure, it seems like it's more like 9 to 12 months.
Yeah.
But it'll be interesting to see on this gentleman, because it's the first time I've done sweating for the forehead, to see how long
How
his
he
lasts.
does.
But it's pretty amazing. You know, I've had brides who didn't want to sweat
For their dress.
for their
and stuff,
dress,
yeah.
and they can do that. It's really neat. What's your favorite area, like that's not like the typical place to put Xeomin?
I would say probably, my favorite area that's not on your typical 3 areas. I would say probably a combination of the lip flip, and lately I've been doing a lot more DAOs. So the DAOs are this muscle here that kind of helps you make that frowning, you know, gesture. So this, and as we get older, you know, we lose those fat pads, they thin out, and a lot more of our muscle starts to show. And a lot of, you know, older women complain, oh, everybody tells me all the time I look mad or I look sad, and I'm not. I don't understand why they keep telling me that. And that's usually a combination of the overactive DAOs, just from years and years of kind of engaging that muscle, and also volume loss. So if you do pop a little bit, you know, Xeomin, Botox, Dysport, it kind of helps just to relax that muscle so those corners pop back up.
Yeah, that's nice. I bet everybody out there could probably guess my favorite area.
Your chin.
The chin. Because I think I think now more people are,
It's getting more popular.
are talking about it, but I am bugged by people's chins, and nobody knows that they do that with their chin, but if you look in the mirror and you pout your lip out, you can usually elicit that.
Yeah.
And it's an overactive, which mine is definitely do. It's an overactive mentalis muscle here, and you can just pop a little bit of Xeomin in there. We'll relax it, we'll smooth it. And the thing is that most people don't realize they're doing that. It's kind of a stress. It goes along with bruxism, so it goes along with your TMJ and your mentalis muscle and the DAOs too. It's all kind of together. So this is an easy area to treat, and this usually will go along with it. But when you do it, it's like people say, oh my gosh, it's beautiful. It's like, I didn't even notice I was doing that. And what happens if you don't do that is you will end up with what we call cobblestoning. Yeah. So
or like
on.
orange peel looking.
So that's an easy fix, and that's probably my favorite. Gummy smile's another one. If you have a gummy smile, so when you smile, if your lip elevates too much, then you'll show your gums, and we can just go boop boop with a little Xeomin. So these are small amounts of Xeomin. These are usually like 2 to 4 units, 8 units, and make a big difference.
Yeah.
Oh, acne.
Oh yeah,
Acne
we've had
is
some
really
good.
cool.
We actually had a good post, maybe a few weeks ago of a patient that had like a big old zit that just kind of came out of nowhere, and it was like after 3 days, after we injected it, had like decreased significantly and was pretty much gone.
Yeah, so I have some young girls who have really bad cystic acne on their face. And a lot of times we can pop that in there and calm it down within 24 to 48 hours. So
Absolutely.
that's amazing. All right, and the lip flip is, of course,
Oh,
we
yeah.
talked about that. Beautiful. So those are all our kind of off-label, obviously, frown lines,
Yes.
crow's feet, forehead lines. Those are always the, the go-tos. So this is just a before and after, this is her raising her eyebrows, and then afterwards just that nice smooth. And some people go, oh, well, I don't want to be like dropping a quarter off there and, bouncing a quarter off. I don't want to be that smooth, but it's really up to you. If you want a little natural movement, I feel like it is more popular now to be natural. And neck bands.
Yeah.
If you like that, I definitely have neck bands. I need a treat.
I think this is very common too in like
yeah.
a lot of our very thin, very active patients. These muscles become very pronounced.
Because they're using them to exercise. And so, all right. So that's pretty much Botox and Xeomin in the bag.
Yeah.
If you have any other questions, kind of let us know. But I want to just take this moment to tell you about something new we're doing. It's really been exciting. Just probably started doing it in January or February. And it's the temple lift. And it's, I think we should change it to the ponytail lift. Because when I was putting my hair in a ponytail today, I was like, wow, that's exactly what it looks like.
Absolutely.
So the reason I wear my hair in a ponytail so much is because when I put my hair in a ponytail, I feel like I look a lot younger, and I think it's just because of this lift up. So we're doing something called the temple lift, and the temple lift is probably, like one of my patients said, that one of the easiest procedures they've ever had. You're not going to have downtime. You might get a little bruise right here, and basically what we're doing is going up with a cannula up to the temple, the back aspect of the temple, and just putting a blob of product there.
Yeah.
And it just is put right there, and you'll see some of these before and afters. But
it's just working on that same vector where, I mean, if you think about it, when patients go and have facelifts, like, they usually lift here and they lift back here. So with the temple lift, what we're doing is that we're getting that lifting all the way up here in the hairline. And that little blob that she's talking about, it's in your hairline, so you don't really see it, but it does such a phenomenal job at really, raising the eyebrow, lifting and contouring the cheekbone, lifting the jowl, the pre-jowl area. Even helps a little bit with the under neck, like laxity that happens, and all of this without adding more volume to your face.
So we're gonna do a little video, and since it's a new procedure, it just for you to see how it's done. Just a little needle is put in there to make a hole, and then the cannula is put in, and it's pushed up in just right under the skin, all the way up to the temple. And once we're there, then slowly I inject a little, we call it a bolus, but you'll consider a little blob of product there. And you actually will be able to feel it. You will be able to feel it in your hairline, but it's in your hairline, so it's not visible. And the worst thing that you'll see is the bruise there possibly. And this is a picture going around her right side. This one side is done and the other side's not, and you can see the nice beautiful lifting difference. It's really, the only way for me to explain it is that it is beautiful, and hopefully I can get back to my...
I think it's one of those fun procedures where like the half and half really is pretty impressive. Like when you can compare the halfway done side and the other side that's not done, that's where you can really appreciate how much lifting power it actually has. Maybe we can do the next.
I have a let me have you help me, because I have a bad virus in my computer which is not making life easy. So, but there we go. Thank you. Thank you, hon. That's definitely what I need to do is get my computer fixed, but patients have been super happy. One of my patients said that it's the easiest procedure they've ever had done.
I think that was
Oh
a
my
good
goodness.
before and after. If we can get it up.
I know, oh my gosh, okay, this is a very infected computer. Hon, if you can get back to when I got there, if you can just put it on where it says slideshow. I'm sorry, but I mean, when I do it, it's just, you see that one side up, and the before and afters from side to side are pretty amazing. And it's just a very natural, beautiful, it looks like you
Yeah,
just went
just
like
lift it.
that. So it's just, everything kind of flows up. You can even see it in the jawline. So you can see that, even her eyebrows a
Eyebrow.
little lifted, her cheeks a little lifted and flows nicely into the hairline. And then the jawline too, you can see it.
Yeah, I love that before and after.
And this is another half and half. That's what we love to do. And you can actually see that the cheek on the one side that's treated almost looks more volumized, because it's all about lifting those fat pads back up into
Even underneath
position.
the eye, you can kind of see how even her tear trough looks so much better.
Yeah, it's to me
And
it's
around
crazy
here.
amazing
Yeah.
how much this little bit of product put right up there does. And that's why I kind of wanted to just let you all know about it.
Yeah.
So we have a secret code today, and I forgot to put it on there. And the secret code today is fresh, because we make you look fresh. It's all about the renew, fresh look.
That's right.
That's, I think, the other thing that makes us different is we're, people don't look like they're done. They just look fresher,
refreshed.
more youthful,
Yes.
younger. So Belotero, I have 15% off, but actually Belotero is 30% off right now, and we have, I think, 10 syringes of the 30% off.
Limited quantity.
Right. So for the next 10 people that email or call and leave a message, or DM us, or message us, you would get 30% off Belotero. So that's to be done under your eyes, around your lip lines. It's really for a lot of different places, necklace lines, and then the Xeomin is 15% off. So, just so you know, you do need to contact us within the next 24 hours
Absolutely.
to get that. So if
And just to reiterate, the 30% off is just on the Belotero. The 15% off for the next 24 hours is on the Xeomin.
correct. So 30% off Belotero, 15% off Xeomin,
But
and
you need to call within the next 24 hours. So you gotta get a hold of Tiara or Annie, and they'll make sure to get you all set up.
all right. So
Now
then-
for giveaways, right? Oh,
Yep, one thing to talk about, because
That's
I
right.
know once I say the giveaway, you're all gonna sign off. So first of all, summer renew bond, summer renew bonds are coming up, and that's basically through June, July, August, September, and it's every week on a Tuesday, right, hon?
yes.
So every Tuesday, you will get a text, an email, be posted on Instagram and Facebook, and it'll be some amazing special, and again, 24 hours to call and prepay for it, and then you have up until the end of September to use it.
Yes.
So that, just wanna let you know those are coming out, and we'll give you more information. Now the giveaway! Woo! For our last seminar of the season, we are going to do first our
Ooh.
firming serum, because
Good stuff.
so our Facebook winner for that is Barbara DiTrapani. Woo! Barbara! So we've got that. You just give the office a call and you can pick that up, or we can send it to you. And we have, for our Instagram winner, we have Jennifer Summer for our eye cream.
Nice.
Woo,
This is a great eye cream. Like, you literally need the smallest, tiniest amount, and it'll last you a good while.
So Jennifer, you're gonna love this. Teeny bit, and that's at the office, or we can mail it, and That's our eye cream that you got. And then for our Xeomin, we have a Facebook winner. We have Julie Aveni.
Yay,
Woo!
Julie!
One area of Xeomin that you're gonna get, and you can do here, you can do crows, we can figure something out to do it
That's
around
right.
your mouth. I mean, you decide. All right.
Yay, congratulations guys, and thank you for tuning in and learning a little bit more about these products with us and the different ways that we can use them.
So this is our first full season of virtual, and I'm hoping in the fall that we're gonna be back here in our beautiful theater. We're sitting in front of our Burt Reynolds 41 seat red velvet seat theater. So we hope that in the fall, and I'm pretty sure that will be the case, that you'll all be joining us for a little wine and food and fun, and we'll still do this on Instagram and Facebook Live too.
Yeah.
And I think it'll work out
It'll be
great.
fun.
So, all right, everybody,
Have a great night.
night.
We'll see you soon.
Thanks for joining us.
Take care.
Are we all
Not too
off?
bad.